The monitors beep in perfect rhythm, then one flatlines. I'm standing in post-op bay 3, watching a man's vitals crash 30 seconds after waking from anesthesia. His eyes snap open, wild, unfocused, and his hand claws at my scrubs with a strength that shouldn't exist in someone who just had his chest cracked open. "Did she forgive me?" he rasps. His pupils are blown wide. His lips are blue at the edges. The attending surgeon is already gone, scrubbing out for the next case. The nurses are rotating beds, and I'm alone with a man who's coding, not from surgical complications, from something else entirely. His grip tightens. His voice drops to a whisper that cuts through the machine noise like a knife. "Did Mom forgive me before she died?" I freeze, because his mother has been dead for 6 years, and what he's about to tell me will change everything I thought I knew about healing. My name is Dr. Noah Reyes, and I've been a resident at Hospital St. Halstead for 8 months now. That's long enough to know the smell of morning coffee mixed with antiseptic. Long enough to recognize the specific squeak of gurney wheels on polished linoleum at 2 in the morning. Long enough to understand that the human body is a miracle and also a ticking time bomb, but not long enough to stop second-guessing every decision I make. It's a Tuesday in early November, the kind of morning where the sky outside is gray and heavy, pressing down on the city like a closed fist. Inside, the hospital hums with its usual controlled chaos. Nurses call out medication orders. Interns shuffle between rounds with tablets clutched like lifelines. Somewhere on the 4th floor, a patient is screaming. Somewhere else, another one is laughing. I'm in the surgical wing, which smells like iodine and fear. The hallways here are different from the rest of the hospital. Wider, brighter. Everything is chrome and white tile, designed to reflect light, to eliminate shadows, to make everything visible. There's a sterility to it that goes beyond cleanliness. It's almost philosophical, as if the architecture itself is insisting that nothing can hide here. No secrets, no mistakes. But I've learned that's a lie. Mistakes happen everywhere, even here, especially here. My attending today is Dr. Marcus Holloway, a cardiovascular surgeon with 30 years of experience and exactly zero tolerance for hesitation. He's the kind of man who can crack a chest, repair a heart valve, and close up in under 4 hours while teaching you anatomy, philosophy, and humility all at once. I first met Holloway on my 2nd day of residency. He'd asked me to name the branches of the aortic arch during morning rounds, and when I'd stumbled over the order, he'd stared at me with those sharp gray eyes and said, "If you can't remember the map, Dr. Reyes, how will you know where you're going?" I've remembered it ever since. Brachiocephalic trunk, left common carotid, left subclavian. Holloway doesn't repeat himself. He doesn't need to. His lessons sink in deep, the way cold water soaks through clothes. This morning, I arrive at the surgical wing at 6:30 a.m., clutching a paper cup of coffee that's already gone lukewarm. The resident's locker room is empty except for Dr. James Park, a third-year surgical resident who's pulling on his scrubs with the mechanical efficiency of someone who's done this 1,000 times. "Morning, Reyes," he says without looking up. "Morning. You're with Holloway today, right?" "Yeah." He smirks. "Good luck. He's in a mood." "When isn't he?" Park laughs. "Fair point." I change into my scrubs, check my pager, and head to the pre-op area. Holloway is already there reviewing charts with a nurse. He doesn't acknowledge me when I approach. He just keeps talking. Patient's BP is stable. Labs look good. Anesthesia cleared him. "We're starting in 20 minutes. The nurse nods and walks away. Holloway finally looks at me. "Reyes." "Good morning, sir. You reviewed the case?" "Yes, sir. Marcus Delgado, 42-year-old male. Severe aortic stenosis. We're doing a valve replacement." "Correct. What's the mortality rate for this procedure?" "Approximately 2 to 3% for isolated AVR in low-risk patients. And the most common post-op complication? Arrhythmia. Specifically atrial fibrillation." He nods. "Good. Don't ask stupid questions during surgery. Stay out of the way. And pay attention. This is a teaching hospital, but I'm not going to hold your hand." "Yes, sir." We walk to the scrub sink together. The ritual of scrubbing in is almost meditative. Hot water, antibacterial soap, brush under the nails, forearms up to the elbows, 3 minutes of repetitive motion that clears the mind and prepares the body. Holloway scrubs in silence. I do the same. Through the windows of the operating room, I can see the patient already positioned on the table. Marcus Delgado, draped and intubated, anonymous beneath the sterile blue sheets. "Reyes," Holloway says quietly, "you're observing today. Stay out of the way. Don't touch anything. And for God's sake, don't ask questions until we're done. Yes, sir. I follow him into operating room 2, where the patient is already intubated and draped. The anesthesiologist nods at us from behind his station. The surgical lights hum overhead, bright and sterile. The patient's chart is clipped to the wall. I glance at it while Holloway preps. Patient, Marcus Delgado. Age, 42. Diagnosis, severe aortic stenosis. Procedure, aortic valve replacement. I read further. No allergies, no significant medical history beyond hypertension. Family history unremarkable. Next of kin listed as none. That stops me. No family, no emergency contact. Just a blank space where someone's name should be. I've seen this before. Patients who come in alone. Patients whose relationships have fractured beyond repair. Patients who've burned every bridge and now face the operating table with no one waiting for them on the other side. It's one of the saddest things about this job. Not the blood or the death or the impossible decisions, but the loneliness, the realization that some people go through the most terrifying moments of their lives completely alone. I don't have time to wonder about it. Holloway makes the first incision, and the room falls into the familiar rhythm of surgery. Scalpel, retractor, suction, the steady beep of the heart monitor, the whisper of the ventilator, the quiet murmur of instructions passed between surgeon and nurse. I watch Holloway work. His hands move with a precision that feels almost choreographed. Every cut is deliberate. Every stitch is perfect. He doesn't rush, he doesn't hesitate, he simply does. There's a beauty to surgery that's hard to explain to people outside the field. It's not the blood or the drama. It's the control, the order. The sense that for a few hours you're holding someone's life in your hands and everything depends on the steadiness of your grip. But it's also terrifying, because one slip, one moment of distraction, one miscalculation, and everything falls apart. The surgery progresses smoothly. Holloway exposes the aorta. The calcified valve is visible even to my untrained eye. Hard, irregular, restricting blood flow to a dangerous degree. He removes it carefully, methodically. The replacement valve is positioned, sutured, tested. Reyes, Holloway says without looking up. What's the most common complication post-valve replacement? Arrhythmia, I answer immediately. Atrial fibrillation, specifically. Good. And the second? Endocarditis, infection of the valve. Correct. And the one nobody talks about? I hesitate. Depression? He glances up. His eyes are sharp behind his surgical mask. Guilt, he says quietly. Patients wake up and realize they almost died. Some of them can't handle it. They start thinking about all the things they never said, all the people they hurt, all the time they wasted. He returns to the valve. Medicine can fix the heart, Reyes, but we can't fix regret. I don't respond. I just watch as he finishes the repair, closes the chest, and steps back. He's all yours, Davies, Holloway says to the anesthesiologist. Wake him gently, and then he's gone. The OR empties quickly after that. The nurses wheel out the instrument trays. The anesthesiologist begins the process of reducing sedation. I linger near the door, watching Marcus Delgado's chest rise and fall with mechanical precision. There's something vulnerable about unconsciousness, something almost sacred. This man has no idea how close he came to death, how the calcification in his valve had narrowed the opening to less than a centimeter, how his heart had been working overtime for months, maybe years, trying to push blood through an aperture the size of a pencil eraser. If he'd waited another month, he might not have made it to the operating table at all, but he did. And now he has a second chance. I wonder if he knows how lucky he is. I wonder if he'll waste it. The surgery is a success. Textbook even. Marcus Delgado is wheeled into post-op bay 3 at 11:30 in the morning, still intubated, still sedated, still alive. I'm assigned to monitor him during recovery. It's standard protocol for residents. Watch the vitals, check the drains, make sure nothing goes wrong in those critical first hours after surgery. I pull up a stool beside his bed and open his chart on my tablet. His stats are stable, blood pressure normalizing, oxygen saturation at 98%, heart rhythm steady. Everything looks perfect, but something feels wrong. I can't explain it. Maybe it's the way his hands are clenched, even under sedation. Maybe it's the faint tension in his jaw. Maybe it's just exhaustion playing tricks on me. I've been on shift since 6 this morning. 12 hours of rounds, consults, paperwork, and now post-op monitoring. My feet ache. My eyes burn. There's a persistent throb at the base of my skull that reminds me I skipped lunch again, but I can't leave yet. I lean back and rub my eyes. trying to shake the fatigue. The recovery bay is quiet. The other beds are empty. The nurses are down the hall, handling a post-op complication in Bay 5. I'm alone with Marcus Delgado and the soft, rhythmic hum of medical equipment. The fluorescent lights overhead flicker slightly. The walls are painted a pale green, supposedly calming, though I've never found anything calming about hospitals. There's a window on the far wall, but the blinds are drawn. A clock on the wall ticks forward. 11:35. Time moves differently here. Sometimes it drags. Sometimes it races. Right now it feels suspended, like I'm caught in amber. That's when I notice the tattoo. It's on his left forearm, partially covered by the hospital gown. I adjust the fabric carefully, and the full design comes into view. It's a name, Elena. The letters are ornate, surrounded by roses and thorns. Below the name, a date, June 14th, 1982, November 9th, 2018. A memorial tattoo. I've seen plenty of these. Patients ink the names of lost loved ones onto their skin like permanent prayers, a way of keeping the dead close, a way of making sure they're never forgotten. But there's something about this one that makes me pause. Maybe it's the detail in the roses. Maybe it's the way the thorns seem to wrap around the letters like they're protecting them or imprisoning them. The artwork is exceptional. Each petal is shaded with gradations of black and gray. The thorns are sharp, almost three-dimensional, and the name itself, Elena, is rendered in a flowing script that looks almost handwritten. I pull up his chart again and scroll through the patient history. There's no mention of Elena anywhere. No listed relatives, no medical contacts, just that blank space where family should be. I lean closer to the tattoo. The ink is old but well maintained. The roses are shaded with incredible detail. Whoever Elena was, she mattered to him. The monitors beep steadily. His chest rises and falls with mechanical precision. I glance at the clock. 11:42. The anesthesiologist said the sedation should wear off in another hour or so. Until then, all I can do is wait. I pull out my phone and scroll through messages. My mom texted this morning asking if I'm eating enough. My younger sister sent a meme about medical residents that's both accurate and depressing. My best friend from med school wants to know if I'm still alive. I type out quick responses to each of them, then set the phone aside. The truth is, I don't know how to explain what this job is really like. The exhaustion, the doubt, the constant fear that I'm going to make a mistake that costs someone their life. I went into medicine because I wanted to help people, because I wanted to make a difference, because my parents sacrificed everything to give me opportunities they never had, and I wanted to prove it was worth it. My father worked construction for 20 years. My mother cleaned houses. They saved every penny so I could go to college, so I could go to medical school, so I could become someone they could be proud of. And I am grateful. I am. But some days, I'm not sure I'm cut out for this. Some days, I feel like I'm drowning. I shake off the thought and focus on Marcus Delgado. His vitals are still stable. Blood pressure holding steady at 118/76, heart rate at 68, oxygen saturation at 98%. Perfect. I update his chart and make a note for the nurse. Then I stand to stretch my legs. The recovery bay is small, just 4 beds separated by curtains. The floor is polished linoleum that reflects the overhead lights. There's a supply cart in the corner stocked with syringes, gauze, IV bags. A crash cart sits against the wall, red and imposing, ready for emergencies. I walk to the window and pull back the blinds. Outside, the city stretches in all directions. Gray buildings, gray sky. Cars moving like ants through congested streets. Somewhere out there, people are living their lives, going to work, eating lunch, complaining about traffic. They have no idea what's happening in here. They have no idea that in this small room, someone is hovering between life and death, that his heart, the organ that's been beating since before he was born, has just been repaired by human hands and titanium instruments. It's both miraculous and mundane. I let the blinds fall closed and turn back to Marcus. That's when his eyes open. It happens too fast. 1 second, Marcus Delgado is sedated and stable. The next, his eyes snap open, pupils dilated, and he's staring directly at me with an intensity that makes my stomach drop. "Did she forgive me?" he rasps. His voice is raw from the breathing tube. His hand shoots out and grabs my wrist with shocking strength. I try to stay calm. Confusion after anesthesia is common. Patients wake up disoriented. They say strange things. They don't remember their own names sometimes. I've had patients ask me where their kids are when they don't have kids. I've had patients demand to know who stole their shoes when they're still wearing them. It's normal. It's expected. But something about this feels different. The grip on my wrist is too tight, too purposeful. His eyes are too focused. "Mr. Delgado," I say gently, "you're in the hospital. You just had surgery. Everything went well. You're safe." He doesn't seem to hear me. "Did Mom forgive me?" He repeats. His grip tightens. His eyes are wet. "Before she died, did she forgive me?" I glance at the monitors. His heart rate is climbing. 120, 130. His blood pressure spikes. "Mr. Delgado, I need you to take a deep breath. I need to know." His voice cracks. "I need to know if she forgave me." The monitors start alarming. His oxygen saturation drops. His heart rhythm shifts, irregular, erratic. I hit the call button. I need help in Bay 3, but the nurses are still tied up in Bay 5. I'm alone. Marcus tries to sit up, tearing at his IV lines. I push him back gently but firmly. "Mr. Delgado, please." "I killed her," he chokes out. "I killed my mother, and I need to know if she forgave me before she died." Everything stops. The words hang in the air like smoke. I stare at him. His face is streaked with tears. His chest heaves. His eyes are locked on mine, desperate and pleading. "Tell me," he whispers. "Please, did she forgive me?" My mind races. This isn't delirium. This isn't confusion. This is confession. The monitors scream. His heart rate hits 150. His rhythm destabilizes further. PVCs, runs of VTAC. I grab the crash cart. My hands shake as I prepare the defibrillator pads. "Stay with me, Mr. Delgado," I say urgently. "Stay with me." But his eyes are already rolling back. The monitor flatlines. Time fractures. I'm moving on instinct now. Chest compressions, hard and fast. The cartilage in his sternum flexes under my palms, still healing from the surgery, still fragile. "Come on," I mutter. "Come on." My training takes over. 30 compressions, 2 breaths. Check the rhythm. No change. Continue compressions. The crash cart is beside me. I reach for the defibrillator with one hand while maintaining compressions with the other, a move I've practiced 100 times on mannequins, but never had to do on an actual human being. The reality of it hits me like a wave. This is real. This man is dying, and I'm the only thing standing between him and death. The pads are already in place. I hit the analyze button. Ventricular fibrillation detected. Shock advised. My heart pounds. My hands are steady, but inside I'm screaming. The nurses finally burst through the door. One takes over compressions. Another preps the defibrillator. A third pulls the crash cart closer. "What happened?" the lead nurse demands. Her name is Catherine, a veteran with 15 years in cardiac care. Her movements are swift and efficient. "He woke up agitated," I say quickly. "Tachycardia, then VFib. No warning." "Charging to 200, Catherine says. "Clear." Everyone steps back. I lift my hands from his chest. The shock jolts his body. His back arches. His arms twitch. The monitor blips, then flatlines again. "Resume compressions." Catherine takes over again. Her movements are efficient, practiced. She's done this dozens of times, maybe hundreds. I step back, breathing hard. My scrubs are damp with sweat. My hands are shaking. This is my fault. I should have seen the signs. I should have called for help sooner. I should have increased the sedation when he first started showing agitation. But I didn't. And now he's dying. "Charging to 300, Catherine calls. "Clear!" Another shock. This time the monitor catches. A rhythm appears, weak but present. "We have sinus rhythm," Catherine announces. "Rate 70, stabilizing." Everyone exhales. I brace myself against the wall. My legs feel weak. My vision swims slightly. A hand touches my shoulder. One of the other nurses, Maria, a kind woman in her 50s. "You did good, Dr. Reyes," she says quietly. "You brought him back." I nod, but I don't feel like I did good. I feel like I almost let him die. Dr. Holloway appears in the doorway, still in his surgical cap. His expression is unreadable. "What the hell happened, Reyes?" "He coded," I say. My voice sounds distant, like it's coming from someone else. "Right after waking up, he was..." I hesitate. "He was saying something about his mother." Holloway's eyes narrow. "His mother?" "Yes, sir. He asked if she forgave him. He said he killed her." Holloway steps closer to the bed. He studies Marcus's face, then glances at the monitors. "Increase the sedation," he orders. "Keep him under for the next 6 hours. I don't want him waking up again until we figure out what triggered this." The nurses nod and adjust the IV drip. Holloway turns to me. "My office. Now." I follow him out of the recovery bay. My legs feel mechanical. My mind is still replaying the moment the monitor flatlined, the feeling of his ribs under my palms, the desperate hope that I could bring him back. We walk in silence through the surgical wing. Other residents pass us, chatting about cases, complaining about attending physicians. None of them notice the look on my face. Or maybe they do, and they just don't care. In residency, you learn quickly that everyone is drowning. You can't save each other. You can barely save yourselves. The hallway feels longer than usual. Each step echoes. The fluorescent lights overhead buzz faintly. Somewhere nearby, a pager goes off. Someone laughs. Life continues. But all I can think about is Marcus Delgado's face, the tears, the desperation, the question he asked, did she forgive me? Holloway's office is small and cluttered. Medical journals are stacked on every surface. A human heart model sits on the desk like a paperweight. The window overlooks the parking lot, where rain has started to fall in thin, gray sheets. He sits. I stand. For a long moment, neither of us speaks. The rain drums against the window. Somewhere down the hall, a pager beeps. Holloway leans forward and folds his hands on the desk. His eyes are tired, not just from today, from years of this. Years of life and death decisions. Years of impossible choices. Tell me exactly what he said, Holloway finally says. I swallow. He asked if his mother forgave him before she died. He said, I hesitate. He said he killed her. Holloway doesn't react. He just leans back in his chair and steeples his fingers. Did you check his chart? Yes, sir. No family listed. No emergency contacts. Just a memorial tattoo on his arm. A woman named Elena. Elena Delgado, Holloway says quietly. His mother. I blink. You know her? I know of her. He pulls up a file on his computer and turns the screen toward me. Marcus Delgado was admitted here 6 years ago. November 2018. Drug overdose. Heroin. The words hit me like a physical blow. I lean closer to read the notes. Patient presented unresponsive. Naloxone administered. Intubated in the field. History of substance abuse. Mother found patient and called 911. Mother suffered cardiac arrest during transport. Pronounced dead on arrival. The words blur. His mother saved his life, Holloway says, and died doing it. I sink into the chair across from him. My mind struggles to process the information. Marcus Delgado had overdosed. His mother found him, called for help, rode with him in the ambulance, and her heart gave out. She found him overdosed, Holloway continues, called for help, rode with him in the ambulance. The stress triggered a massive heart attack. She coded in the back of the rig. They couldn't bring her back. And Marcus survived, went through rehab, got clean, stayed clean as far as I know. Holloway closes the file. But guilt like that doesn't disappear, Reyes. It doesn't heal with time. It just festers. I think about Marcus's face, the desperation in his eyes, the way he grabbed my wrist. He woke up from heart surgery and the first thing he thought about was her, I say quietly. Because dying forces us to confront the things we've been running from, Holloway says. Medicine can repair tissue, but some wounds are deeper than flesh. He stands and walks to the window. The rain is heavier now, streaking down the glass in uneven lines. 6 years ago, I was the attending on call when they brought Elena Delgado in, he says. I tried everything. Compressions, epinephrine, defibrillation. Nothing worked. Her heart was too damaged. The myocardial infarction was massive. He turns to face me. And when I walked into the waiting room to tell Marcus that his mother was dead, he looked at me and said, I did this, didn't I? The room is silent except for the rain. I told him it wasn't his fault, Holloway continues. I told him that cardiac events can happen to anyone, that stress can be a trigger, but so can 100 other things, that he couldn't blame himself. But he did anyway. Of course he did. Holloway returns to his desk. Because guilt doesn't need facts, Reyes. It doesn't need evidence. It just needs a foothold. He sits. Keep him sedated for now. We'll reevaluate in 6 hours. And Reyes? I look up. Don't mention this to anyone else. HIPAA still applies even to confessions. Yes, sir. I stand to leave, but Holloway stops me. And Reyes? You did good work today. You brought him back. I nod, but the words feel hollow. Because I didn't just bring him back to life. I brought him back to guilt. I brought him back to a pain he's been carrying for 6 years, and I have no idea how to help him with that. The rest of the day drags. I finish my rounds, check on my other patients, grab a stale sandwich from the cafeteria, but my mind keeps circling back to Marcus Delgado, to the tattoo on his arm, to the question he asked, did Mom forgive me? I sit in the residence lounge, staring at my sandwich without eating it. The television in the corner is playing the news, something about traffic, something about weather. I don't pay attention. The lounge is a cramped room with mismatched furniture and a persistent smell of old coffee. There's a bulletin board on the wall covered with shift schedules, memos about hospital policy, and a few motivational posters that nobody reads. One of them says, "Every day is a chance to save a life." I stare at it. Did I save Marcus's life today? Or did I just prolong his suffering? Another resident walks in, Dr. Sarah Chen, a second year in pediatrics. She's holding a coffee and looks as exhausted as I feel. "Rough day?" she asks. "You could say that." She sits down across from me. "Want to talk about it?" I shake my head. "Hipaye." She smiles. The universal excuse. We sit in silence for a moment. She sips her coffee. I pick at my sandwich. Sarah and I went through medical school together. We studied for boards together. We celebrated our match results together. She's one of the few people here who understands what this life is really like. "Do you ever wonder," I say slowly, "if we're actually helping people? Or if we're just prolonging the inevitable?" Sarah raises an eyebrow. "That's dark, even for you, Noah." I'm serious. We fix their bodies. We repair their organs. We send them home. But what about the stuff we can't fix? The trauma, the guilt, the regret. "That's not our job," Sarah says gently. "We're doctors, not therapists. Maybe we should be both." She studies me for a long moment. "What happened today?" "A patient coded. I brought him back, but I don't think he wanted to come back." "Did he say that?" "Not in those words, but yeah, I think he did." Sarah leans back in her chair. "You can't save everyone, Noah, and you definitely can't save people from themselves. I know. Do you?" I don't answer. She finishes her coffee and stands. "Get some rest. You look like hell." "Thanks." She leaves. I'm alone again with my thoughts and my untouched sandwich. I pull out my phone and open the browser. I type in Elena Delgado obituary 2018. The results load. I click on the first link. Elena Maria Delgado, born June 14th, 1982 in Mexico City. Died November 9th, 2018. Beloved mother, devoted friend, cherished member of the community. There's a photo. She's smiling, round face, dark eyes. She's wearing a floral dress and holding a birthday cake with candles shaped like the number 40. I read the rest of the obituary. It's brief, generic, the kind of thing written by someone who didn't know her well. Elena immigrated to the United States in 1995, seeking a better life for herself and her son. She worked tirelessly as a housekeeper at the Grand Plaza Hotel for over 20 years, where she was known for her warmth, dedication, and infectious smile. She loved her family deeply and was a pillar of her community. She is survived by her son, Marcus. I scroll down. Below the obituary, there's a comment section. Most of the entries are standard condolences. She was a wonderful woman. She will be missed. Prayers for the family. But one stands out. Posted by MD, November 15th, 2018. "Mom, I'm sorry. I'm so sorry. I'll spend the rest of my life trying to be the man you believed I could be. I love you." I stare at the screen. Marcus wrote that. 6 days after she died. 6 days after he woke up in a hospital bed and learned that his mother had died trying to save him. I close the browser and set the phone down. Outside, the rain has stopped. The sky is clearing. Through the window, I can see the parking lot, the streetlights beginning to flicker on as evening approaches. I think about Marcus lying in that recovery bay, sedated, alone, carrying a weight I can't even imagine. And I realize something. He's not asking if she forgave him because he doesn't know the answer. He's asking because he can't forgive himself. And no amount of medicine, no surgery, no medication, no treatment can fix that. By 8 p.m., I'm exhausted. The hospital feels heavier at night, darker, quieter, like it's holding its breath. I should go home, I should sleep. But instead, I find myself walking back to post-op Bay 3. Marcus is still sedated. The monitors are stable. The room is dim, lit only by the soft glow of equipment screens. I pull up a stool and sit beside his bed. His face is peaceful now. The lines of tension have smoothed. He looks younger than 42, vulnerable. I glance at the tattoo again. Elena.
June 14th, 1982, November 9th, 2018. She was 56 when she died. Young, too young. I think about my own mother, about the sacrifices she made, about the nights she worked double shifts to pay for my college applications, about the way she cried when I got my acceptance letter to medical school. What would I do if I were in Marcus's position? If my actions, my choices, had cost her life, I don't know. I'd like to think I'd be strong enough to forgive myself, to move forward.
To honor her by living well, but I don't know if I could. The door opens. A nurse steps in. Maria, one of the night shift regulars. She's in her 50s with graying hair and kind eyes. "You're still here, Dr. Reyes?" "Just checking on him." She glances at the monitors. "He's stable. Sedation should wear off around 2 a.m. You should go home. Get some rest." "I will, soon." She gives me a knowing look. "You always say that." She's right. I do. She leaves. I'm alone with Marcus again. I pull out my tablet and open his full medical history. The overdose from 6 years ago is documented in detail. The naloxone administration, the intubation, the subsequent stay in the ICU. But there's more. After his discharge, Marcus attended a 90-day inpatient rehab program. He completed it. He attended outpatient therapy for another 6 months. He tested clean at every follow-up. By all accounts, he turned his life around. He got a job. He stayed clean. He built a new life. But apparently, it wasn't enough. Because here he is, 6 years later, still asking if his mother forgave him, still carrying the weight of her death. I close the tablet and look at him. "She did," I say quietly, even though he can't hear me. "I'm sure she did." But saying it out loud doesn't make it true, and it doesn't erase the guilt he's been carrying. I sit there for another hour, watching the monitors, watching his chest rise and fall, thinking about guilt and forgiveness and all the things medicine can't fix. The hospital at night is a different world. The daytime chaos fades. The urgent voices quiet. What remains is a kind of suspended existence. Patients sleeping, machines humming, nurses moving like ghosts through dimly lit corridors. I've always found night shifts strangely peaceful. During the day, the hospital feels like a war zone. But at night, there's a stillness that allows for reflection, for thinking, for questioning all the choices that brought us to this moment. I look at Marcus's face. Even in sedation, there's a tension around his eyes, a tightness in his jaw. His body knows what his mind is trying to forget, that his mother died because of him, or at least, that's what he believes. Finally, at 9:30, I force myself to leave. I walk through the empty hallways. The night shift has settled in. The hospital is quieter now. Most of the patients are asleep. The only sounds are the soft beep of monitors and the distant hum of ventilation systems. I change out of my scrubs in the residents' locker room. My street clothes feel strange after wearing scrubs all day. Less comfortable, less like armor. I step outside into the cool November night. The air is crisp and clean. The rain has left everything glistening under the streetlights. I walk to my car, thinking about Marcus, about Elena, about the question he asked, "Did Mom forgive me?" And I realize something. Tomorrow, when he wakes up, I'm going to have to answer that question, and I have no idea what to say. At midnight, something changes. The sedation is supposed to keep Marcus under until morning, but his body metabolizes it faster than expected. I'm not there when it happens. I went home, showered, tried to sleep. But my pager goes off at 1:15 a.m. Code blue. Post-op Bay 3. I'm out of bed and dressed in under 2 minutes. The drive back to the hospital is a blur. Empty streets. Red lights I barely stop for. My heart pounding in my chest. By the time I arrive, the code is over. Marcus is stable again, but barely. Catherine meets me outside the bay. Her face is grim. "He woke up again," she says. "Started thrashing. Tore out his IV. We had to restrain him and increase the sedation. Is he okay?" "Physically, yes, but Dr. Reyes?" She hesitates. He was calling for his mother. Over and over. "Mom, I'm sorry, Mom, please forgive me." It was heartbreaking. I push past her into the bay. Marcus is restrained now. Soft restraints on his wrists to keep him from pulling at the lines. His face is wet with tears. His eyes are closed, but he's not peaceful. Even in sedation, he looks tortured. I sit beside him and take a deep breath. Catherine appears in the doorway. "Dr. Holloway wants to see you in the morning. He's considering a psych consult." I nod. She leaves. I'm alone with Marcus again. I stay with him for the rest of the night. Not because I have to, but because I feel like someone should. At 5 a.m., the sedation wears off naturally. His eyes open slowly this time, clearer, calmer. He looks at me, recognizes me. "You're still here," he says softly. "Yes." He closes his eyes. A single tear slides down his cheek. "I'm alive," he whispers. "Yes, you're alive. I didn't think I deserved to be." "Why not?" He's quiet for a long time. When he speaks, his voice is barely a whisper. "I was 27 when it happened. Young, stupid, addicted. I'd been using for 3 years. My mom knew. She tried everything. Rehab, therapy, tough love. Nothing worked. He opens his eyes. The night I overdosed, she found me in my apartment. I was on the floor, barely breathing. She called 911. She held my hand in the ambulance. She kept saying, "You're going to be okay. You're going to be okay." And his voice cracks. And then her heart stopped. I don't interrupt. I just listen. They told me later, he continues, after I woke up, after the naloxone cleared my system. They told me she had a heart attack. They told me she died before they even got to the hospital. He looks at me. She gave her life to save mine, and all I gave her was pain. That's not true, I say quietly. Yes, it is. His hands clench against the restraints. I put her through hell. I lied to her. I stole from her. I broke her heart over and over, and when she finally had a chance to stop worrying, when she thought I was going to survive, her heart just gave out. That's not your fault. Yes, it is. His voice rises. The monitors spike. If I hadn't been using, she wouldn't have been in that ambulance. If I had gotten clean earlier, she'd still be alive. I killed her, Dr. Reyes. I killed my mother. The room is silent except for the beeping of machines. I lean forward. Mr. Delgado, listen to me. Your mother didn't die because of you. She died trying to save you. There's a difference. Is there? Yes. I glance at the tattoo on his arm. She loved you. That's why she called for help. That's why she stayed with you. That's why her last words were, "You're going to be okay." His lips tremble. Love doesn't keep score, I say. It doesn't weigh mistakes against intentions. Your mother knew who you were, the good and the bad, and she chose to save you anyway. But did she forgive me? He whispers. I pause. Then I say something I'm not sure I have the right to say. I think she already had. He stares at me. I think she forgave you the moment she picked up the phone. I continue. I think she forgave you when she held your hand. I think she forgave you when her last thought was making sure you'd be okay. How do you know? Because that's what mothers do. The words hang in the air. Marcus closes his eyes. His breathing slows. The monitors stabilize. I've spent 6 years punishing myself, he says quietly. I stopped using. I got a job. I stayed clean. But I never forgave myself. I kept waiting for some kind of sign that she didn't hate me. She didn't hate you, I say firmly. She loved you, and she'd want you to live. Not just survive. Live. He opens his eyes. They're red, but clearer than before. How do I do that? You start by letting go of the guilt, I say. Not because you don't deserve to feel it, but because carrying it won't bring her back, and it won't honor her sacrifice. He nods slowly. And then, I add, you do what she wanted. You live. You be the man she believed you could be. We sit in silence for a long time. The monitors beep softly. The hospital hums around us. Finally, Marcus speaks. What's your name? Dr. Noah Reyes. Thank you, Dr. Reyes. You're welcome. He closes his eyes again. This time, when he sleeps, his face is peaceful. I remove the restraints. He doesn't need them anymore. And I sit with him until morning comes. The next morning, Marcus Delgado is transferred to the cardiac ICU for continued monitoring. His vitals are stable. His rhythm is steady. Physically, he's healing. But something else has shifted. I check on him during my afternoon rounds. He's awake, sitting up slightly, staring out the window at the gray November sky. How are you feeling? I ask. Tired, he says, but lighter. Good. He looks at me. Thank you. For last night. For listening. That's part of the job. No, he says. It's not. Most doctors would have just sedated me again and moved on. You stayed. I don't know how to respond to that, so I just nod. I've been thinking about what you said, Marcus continues. About living. About letting go. And I don't know if I'm ready yet, but I want to try. That's enough. Over the next few days, Marcus's recovery progresses smoothly. No complications. No arrhythmias. No more episodes of distress. I check on him each morning. We don't always talk. Sometimes I just sit with him while he eats breakfast or watches television. Sometimes he asks me questions about the surgery, about his prognosis, about what comes next. Other times we sit in silence, and that's okay too. On the third day, he tells me about his job. He works as a supervisor at a warehouse. It's not glamorous, but it's honest work. He's been there for 4 years. His coworkers respect him. I kept my head down, he says. Didn't cause trouble. Showed up on time. Did what I was supposed to do. That's good. But I never really lived, you know? I just existed. I went through the motions. I told myself I was honoring her memory by staying clean. But really, I was just hiding. From what? From feeling anything. From connecting with anyone. From risking anything. He looks at me. Because if I didn't care about anything, I couldn't lose anything. And I couldn't hurt anyone. That's not living, I say. That's surviving. I know. On the 4th day, he tells me about the tattoo. He got it a year after Elena died. He went to a tattoo artist in his neighborhood and showed him a photo of his mother's handwriting. I wanted her name in her handwriting, he says, so it would feel like she was still with me. The artist spent 3 hours on it. Marcus sat through the pain without flinching. It hurt, he says, but I wanted it to hurt. I thought maybe if I suffered enough, it would balance things out, like I could pay off a debt. Grief doesn't work that way. I know that now. He tells me about her life, how she came to America with nothing but hope and determination, how she worked 3 jobs to keep them afloat, how she never complained, never gave up, never stopped believing in him, even when I was at my worst, he says. Even when I stole from her to buy drugs, even when I screamed at her and told her I hated her, she never stopped loving me. His voice breaks, and I repaid her by killing her. You didn't kill her, I say firmly. You gave her a reason to fight, a reason to call for help, a reason to hold on. But she died anyway. Yes, but not because you weren't worth saving. She died because she loved you so much that losing you was unthinkable. He stares at me, processing, trying to believe. That's the legacy she left you, I continue. Not guilt, love. The kind of love that doesn't quit. The kind of love that sacrifices everything. And the best way to honor that is to live a life worthy of it. He nods slowly. I'm starting to understand that. On the 5th day post-op, I'm reviewing discharge paperwork when Dr. Holloway stops by. You did good work with Delgado, he says. I just listened. Exactly. He crosses his arms. Medicine isn't just about fixing what's broken, Reyes. It's about understanding why it broke in the first place. You did that. Thank you, sir. He nods. But next time, don't sit with a patient all night. Get some sleep. You're no good to anyone if you burn out. I smile. Yes, sir. Before Marcus is discharged, he asks to see me one last time. I find him in his room, dressed in street clothes, his belongings packed. The tattoo on his arm is visible again. Elena, June 14th, 1982, November 9th, 2018. I wanted to give you this, he says. He hands me a folded piece of paper. I open it. It's a photocopy of an old birthday card. The handwriting is shaky but legible. Marcus, no matter what happens, I will always love you. You are my son, my heart, my everything. Never forget that. Love, Mom. The date on the card is from 2 months before she died. I look up at him. His eyes are wet, but he's smiling. I found it in a box of her things, he says. I'd forgotten about it, but after our talk, I went looking, and there it was. She loved you, I say. I know. He takes a deep breath. And I'm going to spend the rest of my life proving that her sacrifice wasn't wasted. He shakes my hand. Thank you, Dr. Reyes. Take care of yourself, Marcus. I will. And then he's gone. It's late when I finally leave the hospital that night. The rain has stopped. The air is cold and clean. The city lights reflect off puddles on the pavement. I think about Marcus Delgado, about Elena, about the weight of guilt and the possibility of forgiveness. Medicine teaches us to fix what's broken, to repair tissue, reset bones, restart hearts. But it doesn't teach us how to heal the wounds we carry inside. Some patients come to us with failing organs. Others come with failing spirits. And sometimes, the most important thing we can do is not prescribe medication or perform surgery. It's to listen, to witness, to remind someone that they are worthy of the life they've been given. Marcus asked if his mother forgave him. I think she did. But more importantly, I think he's starting to forgive himself. And maybe that's the real healing. 3 weeks later, I receive an email. The subject line is simple. Thank you. Inside, there's a photo. Marcus is standing in front of a community center, holding a sign that reads, 6 years clean, still fighting, still living. Below the photo, a single line. She'd be proud. I know it now. I stare at the screen for a long time. Then I close the email and smile. Because sometimes the best medicine isn't found in a pharmacy or an operating room. It's found in the quiet moments when we choose to see each other, not as patients and doctors, but as human beings trying our best to navigate the messy, painful, beautiful act of being alive. And sometimes, that's enough. I walk through the hospital corridors. The fluorescent lights hum overhead. Nurses pass by with charts. Interns huddle around a computer screen. Somewhere, a monitor beeps steadily. I think about the tattoo on Marcus's arm, Elena, and I think about the card she wrote, I will always love you. Forgiveness isn't something we earn. It's something we give to others and to ourselves. Marcus learned that, and in learning it, he found a way to live again. Not just survive, live. I push through the hospital doors into the cool November night. The sky is clear now. Stars are visible between the buildings. I take a deep breath, and I keep walking, because there are more patients to see, more stories to hear, more lives to touch. And sometimes, that's all the purpose we need. In medicine, we learn to measure success in vital signs and lab results, in recovery times and survival rates. But the real measure of success, the one they don't teach in medical school, is whether we helped someone remember why their life matters. Marcus Delgado woke up from surgery asking a question, and somewhere in the hours that followed, he found the answer. Not from me, from himself, from the love his mother left behind, from the memory of her hand in his, from the card she wrote when she still believed he could change. She gave him life twice, once when she called for help, and again when she forgave him before he even knew he needed it. That's the kind of healing that lasts. That's the kind of healing that saves lives. And that's why I became a doctor. Not to cure disease, but to remind people, one patient, one moment, one conversation at a time, that they are worth saving, even when they don't believe it themselves. The next morning, I'm back in the hospital. Another shift, another patient, another chance to make a difference. Dr. Holloway finds me in the residence lounge. Reyes, he says, got a case for you. 53-year-old woman, congestive heart failure. Family's requesting a consult before we schedule surgery. I nod. I'll be right there. He pauses. And Reyes? Yes, sir? Whatever you did with Delgado, keep doing it. Medicine needs more doctors who remember that the heart isn't just an organ. He walks away. I finish my coffee, grab my tablet, and head toward the cardiac ward. Because there's always another patient, another story, another life that needs to be touched. And I'm ready. Weeks pass, then months. I hear from Marcus twice more. Once at Christmas when he sends a photo of himself volunteering at a soup kitchen. The image shows him ladling soup into bowls, surrounded by people who look grateful and tired. He's smiling, really smiling. The message attached is simple: trying to give back, trying to be better. And again in the spring, when he tells me he's enrolled in community college, thinking about social work, he writes, helping people like me, people who think they're too broken to be fixed. I write back, your mother would be proud. His response is immediate. I know. I finally know. And that's when I realize something. Healing isn't linear. It doesn't follow a predictable course. It doesn't happen in a hospital room or a therapist's office or a moment of clarity. It happens slowly, quietly, one day at a time. It happens when we choose to keep going, even when the guilt feels unbearable. When we choose to honor the people we've lost by living the lives they wanted for us. Marcus Delgado almost died twice, once from an overdose, and once from the weight of guilt. But he survived both, not because of medicine, but because he finally let himself believe what his mother had been trying to tell him all along. You are worthy. You are loved. You deserve to live. I close my laptop and look around the residence lounge. It's quiet tonight. Just me and the hum of the vending machine. Outside, the city is alive. Lights flicker in windows. Cars move through streets. People laugh, cry, fight, forgive. And somewhere out there, Marcus Delgado is living, truly living. Not because I saved him, but because his mother did, and because he finally let go of the guilt long enough to see it. That's the lesson I carry with me now. Forgiveness isn't something we wait to receive. It's something we give ourselves permission to feel. And healing isn't about erasing the past. It's about making peace with it. Marcus asked me if his mother forgave him. I told him I thought she had. But the truth is, she never needed to, because she never stopped loving him in the first place. And love, real, unconditional, maternal love, doesn't need forgiveness. It just needs to be remembered. I stand, I stretch, I grab my coat, because tomorrow, I'll be back. Another shift, another patient, another chance to witness someone's story. And maybe, just maybe, I'll remind them that they're worth saving, even when they've forgotten it themselves. That's what medicine is, not the scalpels or the stitches or the textbooks. It's the quiet moments when we sit beside someone and listen, when we hold space for their pain, when we remind them that their life, their messy, complicated, beautiful life, matters. Marcus Delgado taught me that, and I'll carry it with me for the rest of my career. I walk out of the hospital into the cool night air. The stars are out. The city hums. Life continues. And somewhere in that great sprawling chaos, someone is waking up from surgery and asking themselves the same question Marcus did. Am I worthy? Am I forgiven? Do I deserve to live? And I hope, God, I hope, there's someone there to tell them what I told Marcus. Yes. Always yes. Because in the end, that's all any of us need to hear. That we're not defined by our worst moments. That we're not the sum of our mistakes. That we're human, flawed, complicated, but worthy, always worthy of love, of forgiveness, of life. 6 months after Marcus's discharge, I receive another message. This time, it's not an email. It's a handwritten letter, delivered to the hospital in a manila envelope with my name on it. I open it during my lunch break. The handwriting is careful, deliberate. The paper smells faintly of cologne. Dr. Reyes, I wanted to write to you properly, to tell you what your words meant to me that night. I've spent 6 years believing that I didn't deserve to live, that every breath I took was stolen from my mother, that I was walking around in a body that should have been buried alongside hers. But you reminded me of something I'd forgotten. My mother didn't die cursing my name. She died trying to save me. And maybe, just maybe, the best way to honor that is to actually live the life she fought so hard to give me. I'm in school now, studying social work, like I told you. I want to help people who are where I was, people who think they're too far gone to come back. I want to be the person my mother believed I could be. Thank you for sitting with me that night. Thank you for not giving up on me, even when I'd given up on myself. I hope you know that you're exactly the kind of doctor the world needs. With gratitude, Marcus Delgado. I fold the letter carefully and tuck it into my locker. Then I sit for a moment, staring at nothing, because that's why we do this. Not for the recognition, not for the salary, not even for the lives saved, but for moments like this, when someone we helped, someone we touched, reaches back and reminds us why it all matters. I finish my shift and walk home through the city. The evening is warm, spring has arrived, trees are blooming, people are sitting on patios, laughing over drinks. Life goes on, and Marcus Delgado is part of it. Not just surviving, living. And maybe that's the real miracle of medicine. Not that we can fix hearts, but that we can remind people why their hearts are worth fixing in the first place. That night, I call my mother. It's something I don't do often enough. Between shifts and exhaustion and the constant weight of responsibility, I let days turn into weeks without hearing her voice. But tonight, after everything with Marcus, I need to hear it. She answers on the third ring. Mijo? Her voice is warm, familiar. It carries the accent she's never lost, the one that reminds me where I come from. Is everything okay? Yeah, Mom. Everything's fine. I just wanted to call. At 10 o'clock at night, you must be tired. I am, but I wanted to hear your voice. There's a pause, then softer. What happened? I don't tell her about Marcus. I can't. HIPAA, privacy, professional boundaries. But I tell her something else. I just wanted to say thank you, I say, for everything you did, for all the sacrifices you made so I could be here. Noah, I mean it, Mom. I don't say it enough, but I see it now. I see what it costs to love someone that much, to give everything so they can have a chance. She's quiet for a long time. When she speaks, her voice is thick with emotion. That's what mothers do, Mijo. We love, we sacrifice, and we never stop believing in our children. I close my eyes. I know, and I'm going to make you proud. You already have. We talk for another 20 minutes, about nothing important, about everything that matters. And when I hang up, I feel lighter. Because sometimes the healing we give to others reminds us of the healing we need ourselves.